Ellen Simmons for the Rural Radio Network. March is Colorectal Cancer Awareness Month, and the Nebraska Cancer Coalition is working to encourage Nebraskans to prioritize their health and get screened for colorectal cancer. We're joined today by Keegan Williams, a nurse practitioner with Jefferson Community Health and Life in Fairbury, Nebraska. Before we get to you, Keegan, just a quick statistic here. In Nebraska, only 38% of 45 to 54-year-olds report being up to date with colorectal cancer screening. So with that, Keegan, why is it important for people to start getting screened for colorectal cancer at age 45?
Well, kind of one of the biggest things is that of all cancer deaths in people under 50, colorectal cancer for men is the number one cause of cancer deaths, and it's the number two cause of cancer death for women. And so starting that screening early at 45 just gets you a better prognosis, or being found earlier in that disease process helps out. And so with colorectal cancer, especially in Nebraska, the 5-year survival rate for early stage detection is about 92%. And the further, more advanced staging you go, the 5-year survival rate is much lower. So it's 77% for regional diagnosis and 15% for distant diagnosis. And so the earlier you kind of discover, what's going on, the better outcomes people have. And so the earlier detection or the earlier colonoscopies you get, the better outcomes you're going to have. So that's why, 45 and, earlier is a huge number to go off of.
All right. Well, as a rural healthcare provider, what can we do to increase colorectal cancer screening rates in our rural Nebraska communities?
Well, I think a big part of it is just education. Personally, I've had a few patients that come through and, they're terrified of having to do the prep for it. Everybody thinks, you have to drink a gallon of fluid and it makes you feel bloated, and the prep isn't fun. But in Fairbury, I do know that we have 5 different options for medications, and they aren't all a lot of fluid, or some people can even take just simple pill form medications to get their colon cleaned out for their colonoscopy. And I've had folks where that was the only holdup for them and they didn't know about it. And so once they did, they got their colonoscopies done. And so that fear, that kind of just lack of education on what options we have and, the benefits of it is probably the biggest barrier. And so once we can get over that, or, introduce better education on it, we can get higher rates done, which is important because, everybody wants to be here for family members, kids, grandkids. And so if we're not kind of taking care of ourselves, we can't really do that. And getting a colonoscopy, it's pretty simple. You get it done, and hopefully in 10 years, you don't have to do it again. And or in 10 years, it's the next time you have to get it done again. And you can be around for a long time and help your family out.
Absolutely. Well, anything else that you would like to add?
Nope. If anybody has, questions, the best place to start is, just make an appointment with your primary care provider, or even just really any healthcare provider. And they can answer a lot of questions, about, who comes and does their colonoscopies for their facility, or what prep options they have. And there's even, Cologuard out there. So you can not necessarily have to get the colonoscopy done, but still do some form of screening if you're still very hesitant. So just got to get out there and talk to your healthcare provider. I know they'll be passionate about screening and getting stuff done, because preventative health is kind of the easiest health to do. So.
All right. Well, if you'd like to find more information online, you can also find that at anycancer.org/colorectal cancer. That was Keegan Williams. He is a nurse practitioner with Jefferson Community Health and Life in Fairbury, Nebraska. Thanks for joining us today.
Thank you.
All right. And I'm Ellen Simmons for the Rural Radio Network.